A woman's ability to choose if and when to become pregnant has a direct impact on the health and well-being of her and her baby. Every year in the United States, there are 6.6 million pregnancies. Nearly half are considered unintended. That is 3 million unintended pregnancies a year. This is primarily due to inconsistent use of contraceptives or failure to use any method of protection at all. 40% of those unplanned pregnancies are resolved by abortion, which poses difficult moral and ethical problems and continues to be a major political and social topic that involves violence and even murder in the United States. While unplanned pregnancies occur in all socioeconomic groups, they tend to occur more frequently in women who are single, ages 18 to 24 years old, of racial or ethnic minority groups, living in fragile socioeconomic circumstances with low education levels. And sadly, women addicted to drugs also have an increased risk for unplanned pregnancy as well as intimate partner violence. And even though the rate of teen pregnancies in the United States has recently dropped to an all-time low, it still has the highest rates of any other developed country, and 82% are unplanned. Adolescents who have children are more likely to be single mothers and have subsequent unplanned pregnancies. They are also less likely to complete high school, and less than 1% have completed college by age 27. Unintended pregnancy places an independent burden beyond whatever else might already be present. Even among married couples, unplanned pregnancy is associated with divorce after the child's birth. The entire family may suffer from physical, economic, and emotional hardship. With unwanted pregnancies, the mother may not achieve educational or career goals, and she is less likely to seek prenatal care and more likely to expose her baby to harmful substances such as cigarette smoke, alcohol, and drugs. Babies have a greater risk of low birth weight, dying in the first years of life, being abused, and not receiving appropriate resources for healthy development. Despite advancements in contraceptives over the last 50 years and the millions of dollars spent each year on prevention initiatives such as the Affordable Care Act's no-cost contraception, unintended pregnancy rates have remained virtually unchanged. This is believed to be due to 1. Failure to use any contraceptive method, or 2. Using contraceptive methods inconsistently. Many women are guilty of forgetting their pill, and condoms have an 18% failure rate. Human error accounts for a large portion of contraceptive failure, while education and reminder methods rely heavily on individuals to perform a perfect function at the right time, every time. This will inevitably result in a less than perfect success rate. The answer to these dilemmas lie in a family planning method known as long-acting reversible contraceptive, which include both subdermal implants such as Nexplanon and intrauterine devices like Mirena. These are the most effective forms of contraceptives. IUDs offer long-term contraception, have few contraindications. They are cost-effective and covered by most all healthcare plans. They are easily placed and easily removed and have high user satisfaction. They are also recommended by the American College of Obstetricians and Gynecology. Common but benign side effects include irregular but light menstrual bleeding, headache, and weight gain. Pregnancy that begins with some degree of planning has far better outcomes for the family and the well-being and autonomy of the woman, while also supporting the health and development of communities. So, if you're not ready to become pregnant within the next year, ask your provider about the most effective form of birth control and make the right choice. And remember, 1 + 1 = 3, so get an IUD.